nice to see you. My name is Lee, and I'm the one who's going to be doing your full physical examination today. Are you actively having any concerns at all? You're doing okay? Lovely. And for this physical examination, it is full body, so from head to toe. Any concerns or any areas that you needed addressed today, and you consent to all parts being examined? Okay, just like to be sure. And then let's see, any change to your address, pharmacy on file? Any change to your medical history at all? Okay, we have no medications or supplements listed in what you're taking at home. Are you taking any over-the-counter meds or supplements? Okay, good to know. All right. And then let's see here, no new surgeries, no change to your smoking status. Okay. Perfect. All right. So with that being said, do you need any specific blood testing done today that you were looking for? Okay, just making sure. So I'm gonna get some vital signs on you, and then we'll move forward with doing your full body physical. I'll keep my clipboard there. But do you have any questions at all before I get started here? Okay, just making sure. Any history of having high blood pressure? Okay. If you want, we can use that arm right there. Slide your arm through for me. There you go. And how tall are you? Okay. Right, give me 1 second while I check your blood pressure here. Alright, blood pressure is normal. Let me get this extra air out for you. Just keep relaxing. Don't worry about it. Alright, and then you slide your arm out. There you go. Alright, anyone with flu or COVID-like symptoms at home? Okay, and you feel like you haven't had a temperature or anything? Awesome. Let me just get everything going to check on that temperature for you. Little alcohol swab here. And I am just going to put some gloves on for the remaining part of this exam. This is a sublingual temperature, so it actually goes right underneath your tongue, okay? Awesome. Right underneath your tongue here. There you go. Close. There you go. Okay, temperature is normal. Take this off, and I'm just going to sanitize this real quick, and then we'll get started on your exam. Oh, it's been a busy day in clinic today, but that's always good, of course. No issues with that. I'm hoping to just feel like I'm having a super productive day. Just want to take care of so many people here. So I am going to throw this away. And when was the last time you've seen an eye doctor as well as a dentist? Okay. Okay. Dentist. 6 months. Okay. And no ongoing concerns there. Do you wear any prescription glasses or contacts? Okay. And have you ever need to see any other specialists since you saw us? good to know. All right, so we are going to just start with a facial or face head exam. So I'm just going to be pressing on parts of your head as well as your face. Please let me know if any of it causes you discomfort. Pain here, right? Just going to take a look at the lymph nodes in the area as well, making sure if you're not enlarged or painful to you. Okay. I am just going to grab this to kind of help see through your hair. Take a look at the hair follicles. Any issues that you've been having with your hair at all? So no hair loss, flakiness, dryness. Okay, good. Have you noticed any new moles on your body at all? Okay, just making sure. Okay. Okay, overall hair assessment is good as well. I'm going to take a look at your eyes. If you could look at my finger, look straight ahead, keep your head steady. Good. Good. I'm just going to move your lid here. Good. Okay. If you could look up, I'm going to take a look at your nose. Okay. Looks healthy. No nosebleeds, right? Good. Take a look at your ears. There's no signs of an external ear infection. No obvious signs of an internal. Okay. Alright, I am going to have to take a look in the back of your throat here. Okay. Do me a favor, say Okay, just gonna move this around a little bit to look at the tongue, teeth, gums, cheeks, and back of the throat does look healthy. Okay. Alright, we are all done with the oral exam there. Alright, the next thing that I do want to take a look at is your hearing. I just want to make sure there's no signs of hearing loss or hearing disorder, okay? So if you could close your eyes, you're going to listen for what ear you hear the sound and ringing on, and you're going to let me know when it stops. So keep your eyes closed for me. Good. Alright, excellent. The next thing that I am going to test is sensation. Again, you'll keep your eyes closed. For right now, you can open them just so you know what you're expected to feel. I'll test it on your arm here. It's just a little gush of air. Close your eyes for me. Let me know where you feel the air, okay? And you haven't felt any numbness or tingling? Awesome. Another same thing but different sensation. Close your eyes. Let me know when you feel a poke. Good. Good. And they kind of all feel equal regardless of the side that I'm touching? Good. Excellent. Very good. All right, pass that exam with flying colors. All right, I am going to take a quick listen at your heart and lungs. You don't have to do anything right now, just breathe normally. I'm just going to move this over a little bit. Okay, I'm not hearing any murmurs, which is good. Heart sounds are good. Take a deep breath in for me. Again, deep breath in. Deep breath in. Deep breath in. A couple more times. Deep breath in. One more time. Very good. I am going to listen to your bowel sounds as well, so I'm going to move this over a little bit. You don't have to breathe a certain way. Any constipation or diarrhea? Okay. Bowel, heart, and lung sounds are good. I'm just going to press on your abdomen now, as well as just take a general look, okay? I'm not seeing any suspicious wounds or signs of hernia that are obvious. I'm going to press on you here. Pardon me. Okay, no signs of rebound tenderness or distension. Any pain with that? Good. Now we're going to do some percussion. Abdominal exam is normal. Next thing I'm going to assess are your full body reflexes. So I'm going to actually start down here. Since I'm here anyway, I'm going to move this over a little bit. Ankle. Good. Let's do your brachial. Just you can hand me your arm here. Your wrist. Okay. Same thing with this arm, please. You have really good reflexes, actually. It's very impressive. All right. And then the next thing is testing vibration sensation. So keep your eyes closed and let me know where you feel the vibration and when it stops, okay? Eyes closed. Good. And then they're all feeling equal in all places. Good. Excellent. Neurological exam completely intact. All right, let me see. Final thing here is I do just want to take a couple of measurements, so don't mind me. Okay. Kind of like keeping it in the event that you ever notice like a significant change with any of your extremities here. Let's do your abdominal area here. Okay. Do your hips. I'm just going to do each foot here now, okay? And then final one is just going to be your hip. Let's see. All right. Well, it honestly looks like you completely passed your physical examination today. Everything did look really good. One thing I am going to ask of you before you go is we do like to collect a urine sample just to make sure your kidney function is all good. But with regards to all of your other organs, everything looks great. Of course, if you have concerns, you can always come back to our clinic and we can check them out for you. I put your initials on the bottom of this cup here, but I am going to leave this for you right over here. I will give you some privacy if you could just leave that urine sample, and then any test results that we collect in clinic will get sent to your portal or your chart. If you have any questions or concerns, obviously reach out. Otherwise, you should be all set. It's not a problem at all. It was a pleasure seeing you. I'll give you some privacy to get ready here, and the girls will see you at checkout. See you.